At Telefónica Tech, we've got a huge amount of experience of working with really complex projects across a whole range of industries. When the opportunity comes along to work on a project of this sort of size and scale with the NHS, we knew that there was a real positive benefit to that and the ability to really do something beneficial for literally millions of people.
We've been overwhelmed by how successful the secure data environment has been now we're live. We're receiving some 14 new requests every month, so I think it's clear that there's real demand for this. We have a number of projects that are live, and I think we're going to hear now from some of our researchers to talk a little bit about some of the projects that we're delivering.
For researchers, the SDE has allowed us access to data at scales and breadth that we've never had before. For example, there is DART, which is the largest repository of lung screening data of its kind in the world, over 400,000 pieces of information, which is being used in AI analysis to identify early signs of thoracic disease. Another example is Seesaw, which is looking at predicting the risk associated with early surgery within a child's life. And this is being rolled out across many other hospitals around the country.
The Thames Valley and Surrey SDE and Arcturus exemplify a partnership between the NHS and industry, where we curate deep and rich data that can service a multitude of questions in specific disease areas that we have mutually agreed are of vital importance to be able to support benefits to patients. A great example of that would be the work that we've done in gynecological cancers. And this is noted to be an area where the UK has had performance issues, where women's outcomes have not been as good as men's outcomes in cancer. And so therefore it's really topical. The teams have worked together to be able to define a data stack which has been extensive and broad and rich and can answer questions about particular genetic features that a patient might have, but also exactly how they are experiencing care. Together, we have created this deep, rich data set, which has become a resource for multiple projects. And that's really what's special about working within the TBS programme. So everything that is being done from the idea of being reproducible and scalable to service future research.
I have had projects in the past where we've had patients that have been visiting an acute hospital, and the clinician wanted to then assess these patients for the likelihood of dementia and Alzheimer's, and she then wanted to follow those patients up and see if they did end up being referred to a dementia clinic. That was a project that took months in order to get to the point where we could share data and work together and have the outcomes for that project, for that researcher. In the SDE, that will happen in one location and will already join, and the appropriate governance and technical controls will already be in place. So we can join that data straight away.
Research fundamentally acts as the factory for new developments within the NHS, but provide new ways to patient benefit. In the past, this factory has not been working particularly efficiently. It's been hard to get access to the tools and to the data that we need to really produce the outputs that lead to therapies. Now with the SDE network, we have access to those tools and the data at scale, and we can really accelerate the output of that factory, leading to patient benefit.
I think one of the criticisms of sort of technical implementations and projects within data is that sometimes the work is done and you don't see sort of a real benefit from that. You know, things sometimes aren't used. That's something that we really pride ourselves on, that exactly in this case, you know, we've implemented something and together with the SDE team, we're seeing that actually being used really for the benefit of research. And as we continue to see the platform grow, more data come in, we'll see plenty of other projects being facilitated by the data within the SDE. So we're really excited for the future of that.
This is just a small sample of the people and the sectors where the secure data environment is already adding value. We expect that to continue on an upward trajectory as we go forwards.